right, 5 minutes after 11 o'clock. If you're my Facebook friend, by the way, I'm not political on Facebook at all. I just don't like to be political. And Lauren Debick is one of my new Facebook friends.
That's true.
And Lauren is in the studio, and she's here with Michelle Hodges. Michelle's been with us before. And Lauren, of course, is the manager of marketing communications at Ocala Health. And Michelle Hodges is the clinical cardiovascular service line administrator for Ocala Health. So we're going to talk about our hearts, right?
Absolutely.
And the veins that connect to it, the arteries, or just the heart?
Yeah. Actually, we'll talk about the arteries that connect to it as well, because they're very important.
Okay. Well, good morning. Good to see you again.
All right, likewise. Thanks for having us.
And Lauren, you look great as always. She's going to say, so do you.
You got it.
So do you.
You beat her to it.
So do you. Let me show you me. There I am. Oh, no. Don't even do that. All right. So, how are you?
We're doing great.
So our last lady had brought in us salt. So can we start there?
Himalayan salt.
Himalayan salt.
Himalayan salt.
Can we start with food? In other words, diet.
Oh, certainly.
How much does we always hear? And every time I speak to a heart surgeon, I always say, can you tell, like when you're actually in there, if somebody is a big meat eater, if they're a vegetarian, if they use a lot of salt? Can they actually tell that?
Well, we see kind of the byproduct of it. The coronary arteries you mentioned a moment ago, those are very, very important because they actually feed that heart muscle with the blood that it needs to stay healthy. And what happens is sometimes if you have a poor diet or you have other risk factors, we can get fatty deposits in those arteries, and that's really what leads to some significant heart disease. So yes, they can actually visually see the deposits.
And so that would mean to what? Stay away from meat or cheese or fatty stuff?
Definitely fatty stuff. Certainly, most people do eat meat, and that's certainly fine. But you want to try to do lean cuts of meat, chicken, fish. Diet that has like high omega-3s, and some of the fish and nuts that you may see are also really beneficial for you. But cutting down on butter, the real hard fats, butter. If you're going to use an oil to cook with, you might want to try canola oil or peanut oil. So certainly they're fatty products, but they're less harmful than some of the other saturated fats.
Do you do that?
I hate to say I eat butter.
You eat better than what?
No, I eat butter, which I really shouldn't do, but I have to tell you, my cholesterol is very good. Well, butter's really not that good for you. That's one of the things you really should try to stay away from.
From butter?
Yes, because it's a saturated fat.
But so why don't you stay away from it?
I really like it so much. And actually, you'll find that different people are predisposed to higher cholesterol levels, and there's different ratios. You're pointing over here.
Yeah, because when we donate blood, all right, this is the truth. She eats healthier than I do. And when we donate blood, my numbers always look better. My cholesterol numbers, anyway.
Right.
The other numbers, maybe not so much.
Yes, and that absolutely it can happen.
So that's
and
a
that's
biological
kind of where the genetics come in.
Genetics.
So for someone maybe like yourself and myself, I'm kind of in the same situation. While I do eat butter, my cholesterol is actually very good. And aside from just the cholesterol, most people that have had blood work done, they're also familiar with that HDL cholesterol and LDL cholesterol. That's really the good and the bad cholesterol, LDL being
Can I tell you the truth about how familiar I am with those two things?
Yes.
I only know the name.
Okay.
It's like saying I know somebody's name, but I don't know anything about them. So I know HDL and LDL. One's good, one's bad. That's really all I know.
Yeah. Well, let me tell you why then. So we'll start off with the bad cholesterol.
Which one is the bad one?
That's LDL.
And where do you find that? Where does that show up?
Well, basically, the LDL cholesterol is a type of cholesterol that has a predisposition for going and sitting in those arteries that we talked about. So they're the cholesterol.
So you don't want that one.
You don't want that one, but that's the one that likes to deposit in there and cause those blockages. So
where do I get that? Like from rabbit meat and stuff?
No, I mean, again, it comes back from some of the dietary and some of your genetics.
I just picked an animal at random.
Yeah, definitely.
But I mean from animal meat. Okay.
Meat. Butter, all those, saturated.
Oh, it does come from butter. Okay.
Oh, yeah, all those saturated fats can certainly help, shuttle those fats into the arteries. Now, on the flip side is your HDL. That is the good cholesterol, and it does the exact opposite. It actually acts as a little scavenger, if you will.
Yeah.
And if you have a higher level of HDL, which is what you want,
right.
That actually goes to the arteries and helps shuttle some of that bad
it cleans
cholesterol.
It out?
And it takes it to the liver where it's broken down.
Did you know this? this, Lauren?
I did know that.
You know this? So where do I get that from?
Again, actually, there's things that can affect your HDL and LDL levels. So actually, exercise. If you exercise, that can increase your HDL level.
Really?
Not smoking can increase your HDL
Yeah,
level.
I
Again,
stopped
it kind of
that.
goes back
I
to
saw
your
a guy
diet.
yesterday with a cigar, and I said, "Oh gosh, that smells so good."
Yeah, and it's so bad for you, though.
I haven't had one in like 8 years.
Well, that's good. That's probably one of the best things you could do for yourself. Honestly, stopping smoking, watching what you eat.
I always watch it. Sorry.
You can't just watch it go into your mouth. Right? So you have to be selective about what you put into your mouth as far as your diet. So those are things that obviously lifestyle types of things that you can help control and help reduce your propensity for depositing.
So the HDL is about activity, not necessarily about like you don't get HDL by eating nuts or vegetables or something.
I mean, it is a type of fat, but there's ways that you can increase the HDL. So again, basically.
So take a walk.
Take a walk, exactly. Take a walk, decreasing your weight. For about every 6 pounds that you lose of weight, you can increase your HDL by about 1 gram per deciliter. Again, that exercise certainly
Okay.
helps. And again, certainly diet plays into it.
So is cholesterol the main cause of heart disease, or is it?
It's certainly a factor. So definitely, you have your genetics, you have your diet, you have your cholesterol, but that's really what's being deposited in those coronary arteries. And what most people, when they say heart disease, they typically think of 2 different, main classes, if you will. They think of the blockages in your arteries, kind of from your diet and your genetics.
Right.
They also think about, some people have valvular disease, and that's another big kind of
They have
subset. Valvular disease.
Valvular. What is that?
So in your heart typically has 4 chambers in a normal heart, and actually there's 4 valves which are in the heart, and they function as little gates. They open and close. They let the blood travel throughout.
That's the word valvular. Okay,
Right,
got it now.
exactly. So another big subtype of heart disease is someone who would have a valve disease. So 1 or more of their valves is not functioning like it should. It's either not opening fully, or so the blood doesn't get out where it should go.
Is that fixable?
Yes, it is. Fortunately, for some people have valvular disease, and it's not significant enough to really warrant anything. It hasn't affected their lifestyle yet. But a lot of valve disease actually is progressive, and we're really fortunate today. We have a lot of different options as far as valve disease. In fact, go ahead.
Well, I'm sorry, I don't mean to interrupt, but do we feel it? I mean, if you, like somebody's listening, they go, "Oh, I don't have anything, I don't feel anything." Would they feel something?
So typically, if someone has valve disease, they can have a variety of symptoms. A common symptom, and it's going to depend on which valve may be affected, but typically you may have someone that has a lot of fatigue. They could have a lot of shortness of breath. They may notice that, before they could walk out and get their mail each day, and now by the time they get to the mailbox, they're winded.
Okay.
Sometimes people will develop abnormal heart rhythms, and that's actually kind of secondary to someone having a valve disease because it's affecting some of the chamber size.
Okay.
So some people might faint. They might become dizzy. So there's a variety of symptoms which could be indicative that you may be having a valve problem.
There's a billboard in town that says, "Attention women, if you have any of these symptoms, you could be having a heart attack." Are those symptoms just for women?
No, certainly. Most people, when they talk about a heart attack, which is due to the blockages in the arteries we spoke of, most people think of the very overt symptoms, crushing chest pain, or I've got, tingling down my arm, my jaw hurts. And certainly both men and women can have those types of very, in-your-face symptoms.
It's funny, you looked at Robin when you said men, and me when you said women. Men and women.
But actually, women oftentimes, although not always, can have more subtle symptoms. They can actually have, just some mild nausea, maybe some back pain, some fatigue. So,
Wow, that's exactly, that's totally different than what they tell men to look for.
Right, and women can certainly have those classic symptoms of men that men experience, but there's also many, many reports where they don't have that classic crushing chest pain, and they have these much more subtle signs.
Right.
And that's why a lot of times, historically, women, the diagnosis of heart disease has probably been more limited because there hadn't been the awareness of some of these subtle signs, especially for women. So it's nice that there's advertisements out there now that kind of bring that to women's attention.
Help you understand, Michelle Hodges is in the studio. She's the guest of Lauren Debick from Ocala Health, and the phone is ringing off the hook. So rather than us ask questions, maybe they've got some questions. Are you okay with taking a phone call?
Sure.
So if you'll put the headset on, you'll be able to hear the questions, the callers, and the questions. And just make sure you can hear me before we push the button. Yeah, you guys? Okay. Good morning. Thank you for calling. You're on the air.
Yes, thank you. Ma'am, if you're over the age of 60 or so and you go for your yearly physical, should you request a EKG each year? And if you do, would an EKG ever resolve or show you that you might have a restriction of your arteries?
Okay, so that's a great question. So as far as, when you see your physician yearly, I'm sure they're doing a complete physical exam and they're listening to your heart and those types of things. Just that alone can give a physician an indication if you have a normal heart rhythm or if you have any murmurs, which may be indicative of a valve disease. But oftentimes an EKG, for some physicians, that is a normal part of an exam. That's going to kind of vary from provider to provider. But in terms of the EKG determining if you have any sort of a valve disease, that really is not going to be a direct indicator. As I mentioned a moment ago, sometimes patients with valve disease do have some additional arrhythmias that arise. And so if you had an EKG, it might pick that up. But there's really actually some better tests available now for detection of valve disease. But usually when your physician listens to you, if he hears a murmur, then at that point, that is probably going to be indicative of some sort of a valvular issue, and he would probably recommend that you have maybe an echo, which is probably a better test for looking at valves.
All right. Do you have a follow-up question?
No, thank you very much.
All right.
Oh, you're very welcome. Thank you for calling.
And we had another call who hung up or whatever. Call back. We would love to take your call. You know what we'll do? We'll take the break, and then we can take the calls on the other side of the break. Again, Michelle Hodges is here. She's the Clinical Cardiovascular Service Line Administrator for Ocala Health. We're talking about ways to reduce the risk and improve the outcomes of cardiovascular disease. And I think we've learned a lot so far. And we'll take the calls on the other side of the break. We will be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. We'll have a partly sunny and pleasant day today with a high of 76 to 80. Then this evening will be partly cloudy, low 52 to 60. Friday should be nice with plenty of sunshine, high on Friday 78 to 81. From the Florida Weather Center, I'm Holly Holdren.
Hi, this is JP from Penn Flooring here in Ocala. I would like to invite you to come in and visit our spacious showroom where we have solutions for every style and budget. From wall-to-wall carpet to hardwood floors and tiles, we have an unsurpassed selection of flooring. At Penn Flooring, we've provided quality customer service with a family touch for over 25 years. Visit our website at pennflooring.com or come by our showroom, 1201 Southwest 17th Street, just over the bridge. Penn Flooring, quality customer service with a family touch.
Leprechaun Soft Wash is the roof washing method that is safe and effective on shingles, tile, metal and shake roofs, vinyl, wood, aluminum, hardy board and stucco siding, driveways, pavers, and the list goes on. Leprechaun Soft Wash is fully insured and uses biodegradable cleaning products. Plus, Leprechaun Soft Wash offers a spot-free warranty on roof cleanings. Call 751-2325.
No more blimey roof stains with Leprechaun Soft Wash. 751-2325.
All right, 20 minutes after 11 o'clock. Thank you for tuning in. Lauren Debick is with us, and she has invited Hodges to come in to talk to us about our hearts. And we do have a phone call waiting, so let's do that phone call, and then we'll continue with our questions. Good morning. You're on the air. Thank you for waiting.
Thank you. You did kind of cover what I'm talking about, but I do have murmur, evidently.
Yes.
I'm kind of feeling fluttering in my chest. I have actually had the stress test. I've had the treadmill, I've had the nuclear stress test,
Okay.
EKGs, all that. But I'm feeling like I say, that fluttering. And when I feel my pulse, I can actually feel that, skip.
Okay.
Is that an issue that I should actually address immediately, or is it something that's just, not something that happens all the time?
Well, certainly, I mean, a normal person's pulse should be essentially usually between 60 and 100 beats a minute, typically, and you should have a regular pattern. So if you're feeling from time to time that you're feeling skipped beats or, runs of very, high, fast beats, that's definitely something you should be discussing with your physician. Certainly, when you had your nuclear stress test, they were monitoring your heart rate, and it may be for you that just comes and goes. So I would discuss that with your physician. They may recommend what's called a Holter monitor or an event monitor, which is essentially kind of like a EKG that you are going to wear for about 24 or 48 hours. And what that will show the physician is during that time period, it captures every single beat that your heart is producing and the rhythm. And then they can look at that to see if you are experiencing those palpitations or whatnot. They can determine what type of rhythm that is. For patients that maybe, if it only happens to you once every couple weeks, they may recommend what's called an event monitor, which is a similar monitor to what I just shared with you, except that's kept on for up to 30 days. So that's more beneficial for patients that maybe don't have those palpitations on a daily basis that it might be missed. So I would definitely discuss it with your physician. And they may want to
I know when they
consider
did
those.
the nuclear stress test, they said there were absolutely no gray areas. Everything.
Right. So a nuclear stress test, that's a wonderful test, but it does not look at valve function. Nuclear stress test is really looking for blood flow to your heart muscle, and so that's an indication if you're having blockages in your coronary arteries. And so they normally do the test. They do an image at rest, so they can see how much, if there's any impedance to blood flow to your arteries at rest, and then certainly, like you mentioned, you got on a treadmill and you exercised, and then I'm sure they imaged you a second time, and that way they can see what the blood flow is to your heart muscle with stress. So it sounds like.
So what if you have a valve problem?
So a valve problem, like I said, is definitely not a muscle problem. It's not a blockage problem as far as the arteries. So a valve problem can typically be either a valve that isn't opening quite as open as it should, so it kind of restricts blood flow from going to the next chamber, or it can be a valve that when it closes, it doesn't close all the way, and so actually you get a backflow of blood. So
then that cause a stroke or something like that?
Not necessarily a stroke. It typically has more symptoms of fatigue. You certainly can have palpitations. You might, depending on what valve is affected, you could have more respiratory or lung problems with shortness of breath, or you could have just in general kind of weakness, dizziness, if you're not getting enough blood flowing out of your heart. So the good news is, as far as for valves, if you are diagnosed, and typically an echocardiogram, not an EKG, but an echocardiogram, which is the ultrasound of your heart, that's really a great test for looking at the valves, because it allows the physician and the sonographer to actually visualize those valves and take measurements across them. So that's really the best test for a valve.
You are so thorough. But I'm due for a physical, so I will definitely address this with my doctor.
Absolutely. You want to make sure you have great communication with your provider. That's the best way that he or she can help you, is by being very transparent in what your symptoms and any changes that you may have experienced. So.
Thank you so much.
Oh, you're welcome. You have a wonderful day. Thank you.
Thank you. Bye-bye.
Thank you for the call. I see how the dialogue, when we have the phone lines open, I love that, because she could ask questions I would never think of asking, and it's actually applicable to her and probably other people who are listening. So,
one thing I would say, the last caller was talking about valve disease, and certainly, actually about 1 in 8 people over the age of 70, so quite a high proportion, have significant valve disease. And while not everyone.
Really?
Mm-hmm. Right. They're very important structures.
Close to that.
You're not there yet. It's
not
okay.
yet, but every day it's a little closer.
Yeah, it is. Unfortunately for all of us.
How does that happen? I remember being 10. How did this happen?
I know. It goes way too fast. I think when you get married and you start having children, time flies.
You know what they say? Time flies like an arrow. Fruit flies like a banana. It's an old Marx Brothers joke.
Yes. Always the comedian.
You on Facebook, somebody posted a photograph of his chest after, I guess he had major heart surgery, and he showed the the big thing,
Yes.
but it looks like the Frankenstein thing
Right,
going down.
the zipper.
And I thought we didn't do that anymore. Do we still actually open people completely up?
So in some cases, yes, but I will tell you, actually at Ocala Health, we have two surgeons, Dr. Ocean and Dr. Huang, and they have the skill set, and we have the instruments. They've done additional training. So not all patients now, especially for valves, need to have that big open heart surgery, and that's very unique in our area. So typically for CABG right now, which is a bypass, when you have that blockage
CABG.
of artery,
Okay.
yeah, CAB, coronary artery bypass graft.
Okay.
But the acronym is CABG. We call it CABG.
See, I always feel like I better not say something. I'll sound stupid, but then I always say something anyway, and I'm glad I did.
Yes.
Because I was picturing. We
A
went to
vegetable.
we went to the medieval times, and the guys on the horses with the armor, they're slicing cabbage, which has
Right.
nothing to do with what you're saying. I'm sorry.
No, that's okay. So
Imagine if there was a transcribist who did this show; they would go nuts.
there's a lot of interesting medical acronyms, let me tell you.
Okay, so CABG.
But CABG is one of them,
Okay.
CABG. So that's your typical bypass
Okay,
that people
so-
talk about.
okay.
So if someone is having a CABG or a CABG and they need a valve replaced or repaired, we still, right now, we typically do that, what they call a sternotomy, which is kind of the picture you described.
That's where they
we're-
open you up.
We're basically going down your
Have you ever seen
breastbone.
somebody actually in that position with the whole thing opened up?
Oh, absolutely. I've been in open heart procedures
Oh
many
my
times.
gosh, doesn't
Yes.
that hurt? What is it? I mean, what are they doing? Actually pulling your ribs open like a door?
Yeah, we have it's a retractor.
Have you seen
a
it?
spreader.
No.
But then when they finish, they wire them, and it takes a sternum of several weeks to heal, but people do generally well. But the nice thing is for patients that have just valve disease and need either a valve replacement or repair, Dr. Ocean and Dr. Huang, they are actually performing minimally invasive valve replacements at Ocala Health. And instead
wow.
of that, where we're cutting your breastbone and you have the large incision, they can actually perform that surgery with about a 2-inch incision in between your ribs. And the results are wonderful. Obviously, the recuperation time
Really?
is much less, and threat of infection, blood loss, and so we do actually nearly over 70-80% now of our valve replacements are being done minimally invasive, and that's something new in this last year and a half for Ocala.
We probably have way more questions than we have time, but I want to squeeze something in there. When we talk about preventing heart disease, and we talk about how exercise prevents heart disease, right? If January 1st came around, or now whatever, and you say, okay, I'm going to start exercising, it seems like that could cause a problem if you are already at risk, right? Like if you start running all of a sudden and you've got a valve issue, you might die.
Right. Well, I mean, I think, the thing is you have to go, first of all, by the way you feel. Hopefully, as we age, hopefully we're under a care of a physician, and they can also provide some guidance as to what might be safe. But, we're certainly not recommending that all of a sudden you go running 3 miles a day. I mean, I think you have to start simple by taking a walk around the block.
Just walk to the refrigerator, that's good enough?
No, you have to walk away from the refrigerator. So no, you just need to start off slow, and certainly if you're finding that you're having, any, big heart rate changes, a lot of shortness of breath, you need to discuss that with your physician.
That was scary what she said, that she could feel it skipping when she held her pulse.
Some people are very aware and they can feel that, and
Wow.
other people don't have that awareness. It's an individual thing.
Michelle, thank you. You are very thorough, as the caller said. That's
Oh, well, thank you.
outstanding presentation today, in spite of my silliness.
No silliness on your part.
Do you want to give out information, contact, or Lauren, do you want to do that?
Yeah, absolutely. If you do have any questions, if you need a physician referral, if you want to talk to a registered nurse, please feel free to call us. The number is 1-800-530-1188.
And if you have a doctor, a family physician already, would that be a good starting point?
Absolutely. Certainly, most people should have at least a primary care physician. And if they determine that you have any sort of cardiac issues, you're probably best to go ahead and ask, to be under the care of a cardiologist, because they're certainly specialized for the treatment of that. So.
All All right, we are out of time. Thank you for coming in here.
Well, thank you for
very
having
much.
us.
It was really
Have
good.
a great afternoon.
Good to see both of you again. Lauren Debick, as always, you're outstanding. Thank you for coming in. And Michelle Hodges, good to see you again.
Likewise, nice
What
to
a
see
great,
you as well.
For those of you who know somebody who will benefit from this conversation, share it. We make a podcast of all these interviews. We'll put them up on, Robin puts them up on YouTube and Facebook, and share them. And somebody's life could be saved. Thank you, ladies.
Thank you very
Thank you.
much.
We'll be
Take
right
care.
back.
Hello, I'm Lillian Wu, the newly sworn-in Secretary of State addressing the State Department.
As we move forward in a new era, it is important to honor the sacrifices of those who have come before.